Fighting what some doctors are calling a twindemic, health experts say getting the flu shot this year is more important than ever.
Our Brittany Michelson with how the vaccine will help combat the dual threat of influenza and COVID-19 this season.
Doctors with the Texas Tech Health Sciences Center encourage everyone to get their flu vaccine this year. Dr. Stephen Burke says influenza occurs every year as a pandemic, but now with COVID-19, we have two at the same time.
Individuals are continuing to get sick, to fill up hospitals, ICU beds, to be on ventilators, and influenza can do that too.
Burke says that the flu vaccine is the inactivated type, making it impossible for anyone to get infected directly from the injection. And depending on the season and patient population, the vaccine can be anywhere from 40 to 75% effective.
There are a lot of myths about the flu shot, which is a very safe vaccine. It's effective, not 100% effective, but it is a very safe vaccine.
Even though all are urged to get the shot, health professionals say there are two groups that need it the most: those over the age of 65 and children.
This is especially important in our children who are high risk. Any kid who is less than 5 and particularly less than 2 years of age are at very high risk from influenza disease and the complications of influenza.
Dr. Tammy Camp says children are vectors, meaning they can easily spread the disease to other vulnerable populations.
I think it's so important for parents to get their children vaccinated for flu because it's also the way that we can protect them, we can protect other people that maybe are important to those children, like grandparents.
Anyone over the age of 65 is at high risk of becoming seriously ill or dying from the disease, according to Dr. Burke. Dr. Edward Yeoman says pregnant women are also a particularly vulnerable group.
They're subject to a higher incidence of pneumonia, hospitalization, intensive care unit admission, and even adverse consequences for mom and baby.
Babies cannot be vaccinated for the flu until they are 6 months old and are only protected if the mother gets the vaccine while pregnant. Burke says even if you get the flu after being vaccinated, it'll be less severe. Health professionals say this step is so important to fight off influenza, which could lead to more resources to battle COVID-19. Brittany Michelson, Fox 34 News at 9.